concerning that the following some issues they need to face. Some of the problems they'll face by using these substances. Okay. As I mentioned, any sort of counseling, that may be the counseling of behavioral issue, counseling of elderly people, counseling of students, occasional counseling, or the educational counseling, or this workplace, whatever the counseling, occupational counseling, whatever the counseling may be. First of all, this is the order. We have to define the particular substance, or what is, how can you say it's a behavioral problem? How can you say it is a problem of depression? How can you say it is a problem of stress? So first you have to elaborately define, you have to elaborately understand, you need to understand what is actual substance. Then what are the major issues by using this substance they'll face, they'll be in it. So depending on the individual's concerns, there are some following issues, there are some issues by using of drugs or substances. One is it see there are how the individualized plan. So when you are counseling these patients or these clients, this type of individuals, what is our plan of action, or you can say how to change their habit. We need to have some individualized plan of changing their habit, or you can say individualized plans for change. So here, in these cases of substance abuse, one is we need to avoid the financial aspects. We need to resolve their financial aspects first of all. In some cases, I'll give one example. If we there are some these cases, some individuals, their earning is only some 15 or 20,000 rupees per month, but they spend nearly 50% of their annual, that is sorry, that their monthly income only on the these type of taking substance, this type of habits. For example, if they earn 20,000 rupees per month, around 4 to 500 rupees they spend only on this alcohol or any other drugs, that may be cigarettes. So if it is 400 per day, let us 400 per day per this it comes around 10,000 to 12,000 rupees per month. Their earning capacity is 20,000, but they spend 10,000 around half of their salary only on that particular alcohol or any other drugs. So this is the financial aspects we need to address. In individual plans, so you need to understand, you need to assess the individualized capacity of income, or individualized financial aspects, individualized personal aspects, individualized family aspects, individualized, so other aspects of that particular case, the client. So here one aspect is financial stability. How to get financial stability by changing their habit. Individualized plan is one individual plan you can apply, you can follow is financial stability. How to get the financial stability by changing their habit. Number one. Number two is that stability on the family relationship. By doing this, by taking that particular is drug or is alcohol or any other substance, the family relation may be deteriorated. The negative impact of the family relation, if you find any negative impact on that family relations by taking this substance, by using this drug, by using this cigarette smoking, by this alcohol. So here, if they change the habit, so how the improvement of how the stability will be, unstable, imbalanced relations of the family members will be changed as stability over their family relations. First one is attaining financial stability by changing their habit. Before our counseling, before our counseling, if they use this much of quantity, slowly, we need to counsel them to change their habit, so that whatever the stability is not there in that family, financial stability, you need to, by changing their habit, can attain the stability on financial aspect. Then attain the stability in the family relations also by using this drug or any other substance. Their family relations may be not up to the mark. Now, if they stop taking that drug they stop taking of using of that particular alcohol or cigarette smoking. So the stability may be again to regain their stability of family relationship. Then setting and career goals. So before that means when they are using these substances, they may not be in a position to reach their goals in the career. So adjustment in the job adjustment capabilities may be deteriorated. They may be badly impacted by taking this substance. Now our plan should be that by changing their habit or by stopping that particular habit, so they'll be in a position to achieve their, to reach their goal. Maybe some goals, maybe in their job is environment, career goals, you can say. So by using this substance, by habituating of this particular drug or alcohol, they are not in a position to reach their goal. Goal is there, career goal is there, but they are not in a position to reach their goals. Now, by stopping, by reducing the intake of these drugs or alcohol, so there is a possibility of meeting their reaching their goals. That is another change, another individualized plan you need to set as a counselor. Then improving social skills, as I mentioned, financial stability, stability in family relations, then career goals. Then now social skills. Some individuals they want to maintain the social relations because of their base that is habits, because they want to mingle with other members in the society, other members in the group, because of they themselves isolate from the other social groups. They won't be isolated if they want take that alcohol or other areas. So they themselves far away from the social group. In some cases, I'm not talking about all the people, but some cases, some individuals will be like, if we find that type of individuals, so individualized plan should be improving the social skills by changing of their. Then improving assertion skills. So assertion means assertive type of thinking, assertive type of communication, assertive manner of communication. So the way of their communication, their social relations, the relations between the family member, the relations with the society. So assertive manner may not be fine if they have some type of habits. Now, by changing their habits, by changing their lifestyle, we can improve the assertion skills. Then enhancing physical health. Physical health may be negatively impact. The negative impact of these habits may be on the physical health as well as the mental health. So if we change, if you have some individual plan for changing of their habit, so it can be easily enhancing, improving their physical health as well as the mental health. That is the another concern that we need to focus as a counselor to change the habit of this particular these individuals. Learning more effective method for coping with stress, even the stressful conditions. Actually, some individuals they will tell why you take cigarettes, uh, why you have this type of habit of taking alcohol. Their impression is that they will tell that, for example, if they tell that to resolve my these issues, stressful conditions, their way of thinking is that they believe that by using these cigarettes, by taking the cigarette, by consuming this alcohol or any other substance, I'll have some sort of relief. That is the stress relief. methods. That is their wrong belief system. As I mentioned in ABC model also, ABC model of counseling. So the belief system of the client is that by using these drugs, they'll have some sort of stress relief, some sort of relaxation. That is their wrong belief system. Based on the wrong belief system of ABC model, they'll activated events. Means their activities of taking cigarette smoking or these drugs or any other substance. So here, that wrong belief system, or you can say negative belief system, leads these type of activities of taking cigarettes or now the consequences. Consequences means negative consequences on their health, negative consequences on their family relation, negative consequences on their financial aspect, negative consequences on their social relations. Negative belief system leads to negative activities. This negative belief system, negative activities are means negative activities means taking some type of substance leads negative consequences. This is very similar. So here, enhancing physical health, we need to change their attitude to enhance their, to increase their physical health as well as the mental health by changing their habit. Before our counseling, if they use taking, if they use some sort of drugs, so by our individualized plan of that particular case, we need to change their habit. By changing their habit, we may be in a position to resolve their coping with stress. They are not in a position to manage the stress. Now, by changing their habit, so we will enhance the coping strategies to resolve their stress. That is the another concern of individualized plan for changing. Then developing more effective system of problem solving and decision making skills. Problem solving skills as well as the decision making skills. For example, if you observe some individuals, if they have this type of substances for a long period of time, their cognitive or their problem solving capacity, their decision making also negatively. The negative impact of decision making, negative impact of substance use may be on their decision making and problem solving skills. Why? Because they have some sort of confused state. For example, occasionally, months, once in a month, or once in a 2 months, once in a 3 months, or once in a year, that is occasional, or you can say recreational or non-problematic use of this category, there won't be any problem. But here, as I mentioned, chronic cases or dependency on the particular drug or cigarette smoking or any alcohol. What happens? Their total life is depending on this habit, depending on this substance use. So they may not be in a position to think in a systematic way, in an orderly way, in a perfect way. So the problem solving capabilities may be slowly decreasing.
So since their thinking abilities are very low, so as a counselors, how we can approach to them to make them understand because their belief system is very low, poor.
Please loudly ask your question.
Am I audible, sir?
Listening.
Now,
Yes,
yeah, am
please.
I audible, sir?
Not clear, please.
Now, sir? Am I audible, sir? No.
No,
Yeah,
no.
Usha, you're audible.
Okay, my question is like if since their belief system is very low, as a counselor, how we can approach to them means like the way they don't their thinking capacity is very low. As a counselor role, how we can talk to them initial, how to build their trust building with them to talk to them or ask them make a plan for them to get into the routine mode. because we are not prescribing any kind of medications. The
Your
approach.
your question, as I understood, your question is that how to make them understand or how to make them acceptance, how to change their belief system. That is your question. Is it your question?
The approach, how we have, since their belief is very low, what their
Mm-hmm.
thinking ability is very low.
Mm-hmm.
So, as a counselor, what is our role for the chronic substance addictive? Because we don't give any kind of medications to them,
Yeah.
and there is no guarantee that they are willing to listen to us.
No guarantee.
That they wanted to listen to us.
No guarantee of whether they listen you or not. So here
Yes.
only our counseling is this. I
Huh, so how we have
means
to
first of all, see if you plan for 10 sessions or 12 sessions of counseling to this individual of substance abuse case or substance abuse case. Okay. So first of all, you need to in first and second session rapport to be established. Again, generally what happens directly they won't come to you. In only some few cases directly they'll come to you. They'll tell, Madam, I am not in a position to change my habit. That is the reason if you give some suggestions, I'll try to change it. That is one type of cases that you will get. Number one. Number two, by the force of family members, by force of friends or caregivers, they'll approach you. Okay. Once they approach you, first of all, we need to develop the rapport. Okay, that is the initial stage of counseling. Then ask them the same way. Some questions or some listening skills, if you apply in that particular case and situations and the sessions, slowly, one way or other way. Just for example, when I give an example, 20,000 of his income. Just you can ask him, what is your monthly income? What is your profession? What is your monthly income? Okay. So here, if they tell this is my monthly income, then just you can ask him. In the process of rapport establishment, rapport building, interact sessions, no, we can interact with that particular cases. In your
But they
interaction,
don't accept any kind of logical way of benefiting questions.
logical way of
Benefiting. This is not. If you means like income is very only 20K, what you are going to do with your future? These kind of questions they may not accept.
they may not answer.
They
So
will.
why?
They may
These are
not
simple
accept.
questions. Now, why they want to ask her? It's a possibility of there is a possibility of answer for these questions. No, these simple questions. No, madam. We are asking the questions related to the particular case only. It is an individualized plan, no?
Yes, sir.
It's a simple question. What are you doing? When they approach you and they came to your place, that is for counseling, just you can ask what is your name? What are you doing? This is the common questions, no? Yeah.
Yes, sir.
Hello.
Yes, sir. But my question is, you said that regarding income, if we ask, so then next to enlighten him that with this income, what is your future if you are getting addicted to this? How you are going to take care of yourself?
And this is the way you need to ask. No? So
But
this is your
kind
income,
of
monthly income.
questions, these kind of questions, if the subject means the client or counselee, they are means like they are not willing to accept. They are in such a means some people may get addicted due to the depression or some other reasons they will be giving. So
Mm-hmm.
how to means like the refugee basically to deal with refugees.
Okay.
What could be the means like questionnaire
At
which
least
will
you can ask them how is your health condition. Later on stage you can ask the financial aspects. That is the belief system we need to develop from that other side. maybe some verbal communication or non-verbal communication. That is the prime responsibility of the counselor to have some sort of rapport. Definitely, one way or other way, there are different options of starting session. If you want to start the conversation with the client, there are different options. One is that you can have their area of interest. You can get the area of interest of that client, and you can start from other end by asking the interest area of interest. Maybe first session or second session.
Okay,
That
sir.
you mean that is you mean to say that they won't if they are reluctant.
Yes.
Yeah,
Yes.
Ushasriji.
Yes. Yes, sir. If they are
Even
reluctant.
though if they are reluctant, maybe first session or in the second session, definitely you will get some. You will start some sort of communication. Maybe your non-verbal, verbal communications. You have to use various skills of counseling to start conversation. Your gestures.
Yeah, maybe initially they might not be willing to share or get offended with those questions. But I think when those questions come from the counselor, maybe after the session they go and they ponder about the questions and the situations, and then maybe that brings some kind of change. I believe, sir.
Yeah,
But
that's what.
basically,
Kushal.
family and counseling, before taking them to the counseling only, there are many questions what counselor generally to build up the rapport or something, they will be already questioning to them. They sometimes they may get means like annoyed and irritated kind of things, and completely they would like to stop the
See, by
or
asking Ushasriji, by asking one or two questions, you can understand whether they are willing to answer it or not. You can change the mode of questions, type of questions. That's what I am
What I
asking.
understood
oh,
is like what Isha ji wanted to ask is first of all, the thing is, I guess the person who will come for counseling is prepared to leave that habit. He will not come unless he want to leave the habit. No doubt he will come with the pressure of the like family, friends, or anyone. But whoever comes for counseling is made her or his mind that he have to lose that habit. So initially he or she might not be willing to answer, but he or she will open up with the questionnaires we do that.
See if the person along with caregivers or along the family members, you can start the conversation with the family members, his companions, his friends, maybe one person, maybe along with that case, just start the conversation with the other person. One way or other way, he will involve or she will involve, generally he will involve in that conversation. Then you start the conversation with that actual case, actual person. This is one type of technique we use in the counseling of these addiction cases. Addiction.
and what
Directly
about
as
the
they are,
chronic illness
yes,
cases?
yeah.
Means chronically ill apart from like substance abuse, I mean like apart from this drug or any other things, chronically ill the patient, the like long term they are not well, but the thing is like physically they are fit but they are unable to do their own work, so chronically they are ill
That
for
means you
long
are
term.
talking about the madam some cases by using of heavy alcohol or heavy drugs. You are talking about some issues related to the psychological issues, like
Psychological,
yeah, like
chronically ill psychological.
that impact of this substance leads them to face some sort of psychological issue, like the psychosis. Okay,
Yes, sir.
so in that cases, what happens in those cases? Direct counseling is not possible. First of all, pharmaceutical, that means medical medicines to be used initially. That is the reason. Generally, what happens in OPD cases, like these outpatient, they won't. It's not so easy to treat them as an OP patient. Okay, for these type of cases, chronic cases or some sort of addiction cases of drugs, In psychiatric hospital, it will be better to admit them as an inpatient. So after some days of taking or giving some medicines, slowly, their understanding capacity will be enhanced for some days. Then after that, better to provide the psychological counseling.
Okay.
Then after some days, along with the psychological counseling, then pharmaceutical, that means medical management. Yeah.
Oh yes, sir.
Thank you, sir.
Is it okay?
Please continue, sir. Thank you,
Yes,
sir.
sir. Thank you, sir.
Yeah. So means it depends on that is the reason we are talking about the individualized plan for change. Individualized plan based on their condition, depending on their intake of drugs or any other substance. So we need to take the counseling steps. Okay, then developing more effective problem solving and decision making skills, that is also one concern of counseling to these individualized cases. Then relaxation skills, relaxation techniques, some type of relaxation technique like Jacobson's technique of relaxation. You know Jacobson's that is relaxation techniques. Okay, then learning to recognize and express feelings, and see adapting more effectively to work what is status. Developing social support system. Social support system means, especially in the rehabilitation centers, what happens if they admit in the rehabilitation center, as in generally there are different type of treatment for these cases, like medical man. Initially, if it is only these non-problematic cases or that is severe cases, through counseling we will address these issues. Second type of category means if it is chronic issues. In the chronic issue also, again, there are two types of categories. One is better to admit as inpatient for only few days, 1 week or 2 weeks or 3 weeks. That is the one type of medical treatment. Then say third type of cases will be like that. They need more. That is, they need a long-term treatment. Long-term treatment means some months they need to stay in those hospitals or in the rehabilitation centers, or you can say de-addiction centers.
Sir, developing social support systems, how is it related with the school environment? If this drug addiction happens in school children, and what kind of social support system we can provide in the school environment?
Yeah, here I'm talking about that is social support system is not possible in the school children related to school children. This social support system is in the rehabilitation centers. It's not related to the school children. In school children cases, family support is enough. Family support system, developing the family support system.
Okay.
Social support system is related to the rehabilitation centers as well as the elderly cases, case of elders.
Okay. I thought maybe the other staff members or teachers, the way they treat him must be changed, something like that.
Here,
I thought.
family support system is enough.
Okay.
Because school children means mostly they are up to age of 16 or 17 years.
Yeah.
Their social skills will be, their social interactions will be very limited because they are only the school environment.
Got it, sir. Thank you. Yeah.
So for this school children, better to provide the family support system or period support system. Generally, family support system is enough. And one more thing I want to tell you here: if these 14 years, 15 years, 16 years children is habituated to that particular drug or any other substance, means what is the actual reasons of these cases? Can you guess?
Stress.
What might be the reasons of these cases? School children is
Competition,
Maybe
stress,
peer influence.
family pressure.
First of all, family environment. No? Family environment.
Yeah, the pressure of the family for
factor of
scoring.
these cases is family environment. If the family environment is not up to them or not suited to the children, then secondly, they'll approach the school authorities or school teachers. For example, if the 14 years or 15 years cases if the parents are not emotionally attached to these children, they may not be in a position to express their emotions with the parents. Got it? The second solution, the second option of these children is teachers. They wanted to express their emotions, their issues. Initially, I'm talking about the initial stage of these issues to the teachers, class teachers, or the favorite teachers in the school. If they are also busy with their curricular work or curricular extracurricular work, they are least bothered about these cases. What happened? These type of children form a group, maybe 3 members, 4 members in that class or school. They form a small groups. They'll start their other social deviated methods.
Thank you, sir.
Yeah. So now the social support system is not possible here in these cases. The support system should be from the family members, siblings, the school authorities. Where the problem started, from that end only we have to start the solution also. Most of the cases of my experience, the reason is only family environment is not suited to the children. They are emotionally detached with the family members. That is the reason they'll opt some other measures of getting. Any doubts?
No, sir. Thank you, sir.
Yes, social support system is related to the elderly cases and other recreational centers, that means rehabilitation centers, and even in the de-addiction, because they'll form some group of people having the same issue. Okay, so that is group counseling. Of course, social support system is also one of the these solutions for these children, or maybe for elder cases. So these are the other cases. Then involvement in the recreational and social that is activities. Recreational and social activities. This is also related to the elderly people. By involving in the recreational activities and the social activities, they will be busy with these activities. Okay. So our concerns as a psychologist, the counselor, we need to focus on these issues or concerns. Another thing is dealing with the mental health issues. I already told you some sort of chronic cases, long-term cases of these substance abuse leads some long-term intake, heavy intake of these substances leads some mental health issues like OCD, psychosis, neurosis, and schizophrenic cases. You know that schizophrenic cases means hallucinations, delusions, even the hallucinations also, visual hallucinations, auditory hallucinations, and delusions. Okay. So these are the mental health issues. So as a counselor, we need to address these issues also. Slowly, what happens? So increasing the self-esteem and self-efficacy. By changing their lifestyle, you can increase their self-esteem and self-efficacy. Yes. The next thing is that, so here after individualized plan of change, some sort of reasons we need to check. Means whether it is a family issue or the issue related to the workplace or their social environment. So family environment, social environment, workplace environment. So reasons of this substance abuse, reasons of these cases also, reasons of these issues also we need to find out. Some cases, multicultural perspectives also we need to check. Multicultural perspective means diversified client populations, diverse. So addiction in addition, counselors work with a client population that is becoming more diverse every day. So because their clients are so different, counselors must have many strategies in their issues. What works for, see, so diversified client population means, as I mentioned, when any issue of psychological or any issue of these cases, we need to check the reasons, root causes of this particular issue. So if the issue is because of their diversified issues, we will get the clients from the different cultures. So in individualized plan, we have to understand the clients' various environmental factors. Maybe family environment, how their family environment, how their workplace environment, how their social environment. Okay, that is the importance of context. So in these cases, the importance of why they chosen this option of getting relaxation. So the context why they started taking this particular alcohol. The context also we need to understand. When you are changing their lifestyle, when they are planning for individualized plan for changing of their habit. So the context also we need to understand. One is the diversification of the clients, diversified class, this client population. Second is the importance of the context. Then fresh perspective, the models that are most frequently used in the addiction treatment first develop to meet the needs of the homogeneous group of clients. Now we need new models, innovative techniques. So these regular models, traditional models may not be worked out in some cases. So you better take the innovative models or the fresh new models of changing this habit. The need of flexibility. Counselors need to aware that their own cultural backgrounds affect their worldviews. The assumptions that we make about the world are not always. So flexibility, need for flexibility. You need to change your models based on the need of the client, need of the person, need of the individual. Okay. So as I mentioned, after studying the various environmental factors, better to provide the counseling depending on the environmental reasons and factors. So here some sort of programs, rehabilitation programs, the therapeutical communities, then group counseling, some sort of outpatient counseling agencies, even as an outpatient also you can treat, but there are some agencies of providing these outpatient services. These are some other ways of therapeutical procedures. And some sort of employee assistance program. In that employee assistance program, the colleagues of this workplace, maybe job, so they'll give some sort of support. That is employee assistance program. So in case of counseling for alcoholic dependence, means some sort of alcoholic cases, that is dependence cases. Okay, so in this case, establishing rapport, including management of crisis situation. So maybe some crisis may arise. That is the reason they approach the counselor. Got it? The reason of approaching these patients, this client to the counselor means maybe some crisis. They are not in a position to manage the crisis of family. They are not in a position to manage the financial this crisis arising in their these personal aspects. That is the reason to manage the crisis. To resolve their crisis, they may approach the counselors. Okay. So in that case, so you should be in a position to resolve the crisis. Okay. Some sort of that is, they need some sort of assistance to resolve their financial aspects. In order to resolve their financial aspects, you need to check that root cause of this financial conflicts, financial crisis is this addiction. Then, in order to resolve the financial crisis, you can go for the counseling to this addicted people. In order to resolve the family crisis, In order to resolve the other crisis in the workplace, you can go for the psychological counseling for these cases. These cases may be from the alcohol dependency, the counseling may be from drug addiction cases. Okay, so if they are frustrated with these issues, so definitely they'll one day or other way they'll come to one day or other day they'll come to the counselor. Some sort of cases, use of medicines for quick relief. They will use some type of medicines for quick relief. That, as I mentioned, if the case is chronic case, it is dependency case, it's not so easy to give psychological counseling because their mindset is not in the level. So what happens? We better to provide some medicines with the help of the medical doctors. Then after some days, their condition is increased, their deteriorated condition is somehow it is improved, then we better to provide counseling. So generally, in inpatient cases, in starting few days, starting phase, just use of medicines. Okay, so after some 3-4 days, if their mental status is stable, then starting the psychological counseling. When they provide the psychological counseling, their condition is improved slowly. What happens? They reduce the giving the use of medicines. So finally, only with the that is psychological counseling, the case will be treated. So this is one type of counseling. Then confusion on the child. Some cases they'll approach the counselor because of the issues related to the children. So child rearing techniques. So confusion on child rearing techniques. Confusion concerns the best type of child rearing techniques leads to feeling of uncertainty, helplessness, inadequacy. So if they feel that I am not in a position to control my children because of my habit, my that is this type of habit, addiction. So this type of cases, there's a chance of approaching these type of cases to the counselor. Got it? So various cases depends on the case, depends on their need, depends on their level of acceptance, depending upon their level of mental stability. We need to provide the counseling. Any doubts?
The practical point of view, will we have this in our practicals also? We can apply in our practicals like.
Means there are some models, madam. There are some models of applying the treating these children, treating these patients. Practicals means practical manner means counseling is totally
like upcoming practical exams, practical classes will be having like.
You are talking about your practical things. I am talking.
Yes,
I am thinking of our practice in our counseling.
The practice also and these practical exams also, both.
Practice of counselors, one point. Second is practicals of your examination point of you are talking about both.
Yes, sir.
First of all, I'll explain about the practical examination. In practical examination, there won't be any practice of this type of cases. Okay.
Okay.
Because problem is that subjects you need to bring the one subject, no?
Yes, sir. Yes.
Not so easy to get the subject.
No, we can study this practically. Just I wanted to check that.
No, just tell me, your doubt is only related to the practical examinations of your
yeah, it was there, but now it's clear. Yes, we have to bring a subject, so we cannot subject.
It's not so easy to get.
It's not possible in 6 days and in this possible time.
Yes. So coming to the practice of our counselor centers, counseling centers. Yes, we'll have to practice. See, any case of, especially these cases of drug addiction. So what to do? Generally, directly there's a chance of getting the cases directly, but very few cases they'll come directly to the counselor. They will approach. Very few cases, very limited cases, they'll approach the counselor. So maybe some crisis arise. As I mentioned, the crisis related to the family, the crisis related to their health, the crisis related to their that is job environment, the crisis related to their children. If these crises are, then only they'll approach the counselor. In some cases, other type of cases like other case of like means by force of the caregivers, maybe family members, elders, or the friends, they'll come. They'll approach the counselors.
But in school, we do work as a counselor, school counselor, like for the children who are in schools.
Yeah,
In
yes,
schools,
yeah.
we are working as a
In school children,
counselor.
generally what happens in school cases, children cases, generally the school authorities, they will approach the counselors, like head of the institutions, class teachers. You know that
Yes, sir.
nowadays, even
Nowadays they are appointing one school counselors as a part of the every week. 2 sessions will be given to them.
yeah, that is like counselors in a daily basis way, or monthly once or twice, or like guest faculty members like that. Okay, so in this nowadays, maybe CBSE, ICS, and state board exam, especially as far as the new education policy are concerned. So the teachers are not taking, they are not in a position to take the responsibility of these cases. Okay, so that is
Yeah, every school
Generally,
has
they are
appointed
getting
their
blamed.
counselor.
yeah.
But generally, they are getting blamed because of the peer. But how this peer group is also getting into contact? When some only certain school children are only into this. Let
Only.
us into this subject, this substance abuse means they are getting addicted. First,
Mm-hmm.
initially they go for means like just for the fun. Later, they are getting addicted.
Mm-hmm.
Only certain schools, like not every school, it's happening.
Mm-hmm.
So, what is the source? It's like attracting them, or they are getting motivated to go to such areas. So, how to stop? How to educate them to
Madam, in any
basic
school,
education?
they see as a PTM or PTA. Okay, Parent Teacher Association. Got it, Ushastriji?
Yes, sir.
So they'll conduct generally in almost all schools now, maybe at CBSE, any state board examination ICSE schools, monthly once or twice or once in a 2 months time. They'll arrange the PTM or PTA, Parent Teacher Association meeting or Parent Teacher meeting. I used to go some in the previous, some for 10 years back, I used to go some Kendriya Vidyalayas as an honorary advisor to address the PTMs or PTA. Okay, what happens in the group counseling? They'll give some sort of 1 hour or 2 hour sessions, 2 hours instruction. They'll give to the whole this group of parent teachers. Okay, and if the parents approach these counselors or the psychologists, see, this is my child's case, sir. So what to do? From the group counseling, we will start the individual counseling. Individual counseling. So call that particular parent or the child in a room, then we will start the counseling. Okay. So after getting proper understanding about the client along with the parents, then we will give some plan of action, like 1 week sessions or one, that is 7-day sessions or 10-day sessions. Your question is that how to approach to the counselor from the school. That is your
No,
question.
no, sir. No, sir. My question is, what is the lifestyle leading them to get attracted to the substitute? Means like they are getting addicted to the substance. Because parents nowadays, they are much focusing on their career and enhancement, betterment of their children. They are not much focusing on their psychological well-being.
You are talking about the age group of the child, or
Yes.
you are from Telugu background, Hindi background, English background. I am not understanding. You are not clear about your question. Why? That
కాదు సార్, నేను తెలుగులో ఐ విల్ ట్రై
అడగండి.
టు
Okay,
ఫ్రేమ్
అడగండి. No
తెలుగులో.
problem.
ఐ
అడగండి.
విల్ ట్రై టు ఫ్రేమ్ సార్. లైక్ స్కూల్స్లో ఉన్న పిల్లల్ని, లైక్ పేరెంట్స్ ఏంటంటే వాళ్ళ పిల్లల బెటర్మెంట్స్ కోసమని వాళ్ళ కెరియర్ మీద ఇంకా వాళ్ళకి ఏది కావాలంటే అది తెచ్చి ఇవ్వడంలో ఎక్కువ టైం స్పెండ్ చేస్తూ దే ఆర్ నాట్ బిల్డింగ్ సైకలాజికల్ బిల్డ్, అంటే లైక్ బిహేవియర్ వాళ్ళది ఎలా ఉంటుంది, హౌ దే ఆర్ కాగ్నిటివ్లీ అండ్ సోషల్గా ఎలా వాళ్ళు ఎదుగుతున్నారు అనేది దాని మీద ఫోకస్ ఎక్కువ ఉంచడం లేదు. సో
very clearly
లైఫ్ స్టైల్
explained in the initial stage of my class today. The main reason of this type of cases in the school, the main root cause is parents. That's all that I told you.
ఎస్ సార్.
You are
అయితే
the-
మనము సిన్స్ ఇప్పుడు నా పేరెంట్ నా పిల్లాడు ఈ పీటీఎంలో ఎవరైతే కౌన్సిలర్ వచ్చి అడ్రస్ చేస్తారో దే హ్యావ్ టు ఐడెంటిఫై వెన్ దే ఆర్ అనేబుల్ టు ఫోకస్ వాట్స్ హ్యాపనింగ్ విత్ దేర్ చిల్డ్రన్, హౌ దే విల్ బీ అప్రోచింగ్. ఈవెన్ టీచర్స్ ఎవరైనా సజెస్ట్ చేసినా దే ఆర్ ట్రీటింగ్ అస్ as an enemies. You are telling me to means you need to consult a counselor. So such
No, what
kind of
I
things.
understood is what Usha ma'am want to ask is, she's telling like when we raise an issue in PTM after the session, like group session also, if we see a child having a problem, if we approach their parents, the parents are getting angry. Like, how can you say my child is aggressive or having different behavior? How can you do that? Instead of they themselves concentrating on their children's behavior, they are blaming parents, teachers. So that's your question, right, Usha?
Yes, to how to educate these kind of parents then, because
Yeah,
we need to educate the parents to better for the betterment of the children.
so they need to develop some relationship with their children. So we need to like ask them to go for counseling, or we need to counsel the parents. Yes, sir.
See, very simple question. Why you are twisting your question? Very simple, now.
So
Very
as
simple
we are the
question. Your
parents,
question is very simple. Why you are asking in the different complexities?
Usha and
Your
I,
question, Usha,
I
see?
think we are in the same shoe. We are
Your
parents of
question is that, as
teenagers.
far as my understanding is concerned, your question is that how, see, I am not in a position to observe my child, number one.
Yeah.
So how to approach the counselor? So simple, na madam. Just you.
No.
So,
As a parent of teenagers, like we are parents of teenagers. So when we go to school,
You are a teacher, sir. There is a counseling session you are giving to us, and we, as a parents, we fail to identify there is a problem going with our children. It's an example, not true. It's an example I'm giving X Y factors. So you have approached us. This is the problem your child is facing. These are the things you have to take care. So as a parent, I am saying that వాట్ ద హెల్ యూ మీన్స్ లైక్ ఏం మాట్లాడుతున్నావు నువ్వు, నీకు సెన్స్ ఉందా అని చెప్పేసి ఐ వాస్ జస్ట్ ఐ ఆమ్ టాకింగ్ యాంటీ అగ్నెస్ట్ టు మై ఓన్ చైల్డ్ బెనిఫిట్స్. సో అలాంటి సందర్భంలో నాలాంటి పేరెంట్స్ కి హౌ టు కౌన్సిల్, ఎందుకంటే వీ నీడ్ టు ట్రైన్ ఫస్ట్ టు ఐడెంటిఫై ద చిల్డ్రన్.
See. If you study properly the characteristics of adolescent, what it the developmental milestones of the adolescent people, like from 12, 13, 14, 15, 16, 17, up to 18, what are the various characteristics of this adolescent? If you, as a parent, as an educated parent, you are educated parent, you are professionals, you are all postgraduate students, maybe postgraduates after some months, okay? So be an educated parent if you have thorough understanding of their characteristics in this particular age group. Yeah, man.
I'm not talking that
yeah, of course, I'm not talking about you.
like
I'm talking about in general
like
context
parent,
also.
in general context.
In general context also.
Just to make you understand what I am trying to frame.
no, what our question is, if all parents are not psychologists, all parents
I'm talking
are not
about
like,
just
as
example.
a layman.
That is example, even in general condition, specifically and
in general condition, how to counsel the parents like their children have some
yes, that
problem.
is the reason. That is I'm talking about that only. So
because
you need to
my
educate
students'
you need to
parents
educate the parents.
They are in
These
the
are
politics.
the quite common characteristics in this age.
My students' parents are in the politics. I cannot approach them. This is the problem. So to educate them, I am finding difficult.
So in educating also, first of all, we have to be empowered with the different subject aspects.
Because as a teacher, they are my children when they are in my compound in the school. So definitely, I feel some kind of array they
Even see, as a teacher, madam, as a
Huh.
teacher, but see they are trained teachers in any school. If they are trained teachers, in their training, major part of the psychology in their training, maybe BEd training, MEd training, DEd training, what diploma in education, bachelor of education, masters in education, that means training of the teachers. The major part of psychology subject is related to these children only. Definitely they have some understanding about the various developmental characteristics of these children in these age groups. So I am repeating the same thing. Counseling is not from our own experience. Counseling, that maybe this type of counseling, maybe any sort of counseling, is based on the theoretical aspects. I'm talking about the theoretical aspects of the adolescent stage, various characteristics of adults. There is theoretical aspect. If the teachers, the parents, the teachers, especially the teachers, are having proper understanding of these various characteristics of adolescent, definitely they will address these issues in a systematic way. Number one. And you are talking about the parents. The parents are not up to the, that is, they may not be educated people. That is our role to educate them, to provide this type of education to the parents so that they'll understand their children in a better manner.
Because children are nowadays they are so intelligent and smart. In front of their parents, they are very innocent, but actually they are getting deviated.
That is counseling skill of our psychological professionals. You can't say it is a very active, they are very smart. No, this type of no. Even though they are smart, even though they are active, it is our role to address the issues.
Parents are not willing to accept that their child is getting addicted to the substance, means like cigars.
If they are not accepting their issues, you need to show the consequences are not of accepting. Those consequences you have to show.
Okay.
Definitely they will, like one way or other way, if you use the proper counseling skills, definitely they accept.
Maybe to bring them to a understanding of that the child is under the influence of or using the substances, you can give a checklist. See if your child is behaving in this manner, or are there some instances where he is alone or shut up, or how frequently is he going against you, or such kind of checklist. If we give them, then they will observe and then they come back. Maybe in that way we can get the parents to our point of view, or
We can
how
involve
they
parents.
yeah, maybe that will help the maybe unwilling parents to listen and try to understand their child.
There are different methods of checklist, maybe one way, but different ways of getting information from the parents and make them understanding, make them accept their issues. So there's different ways of providing counseling to the children as well as the parents also.
But is there any technique, sir, where we can means like we can guide the children that they are what they are doing is wrong, since they are already into that.
Yeah.
To make them stop, like what kind of like basic things we can counsel them.
That's what I other told. It is some techniques means the technique of ABC model is one technique. These are all the psychological techniques, psychological models. Techniques means the techniques related to the psychological subject. No?
Because with the teenagers, what kind of means like we are just students. So which thing we can just guide them to adopt, means which factors we have to choose that will help us to deal in the real world counseling.
For example, if they are in the 10th class or 9th class, first consequences you have to can show that people is that if you have this type of habit, taking cigarettes, if the other classmates in the class, if they know what is their response, They won't allow you to mingle with the activities. That is one consequence you can explain.
But they are influencing other students, no, sir, not one. So one is getting the influence of bad is more than the positivity. See, all children are getting means like
Hello, madam.
yes.
Madam, sorry, this Pavan here. Okay, madam, first thing is nobody will be ready. Okay, today the environment and the society has money. Okay, they will not be ready to listen to what you are talking about your kids. The
Not my
environment has
children. Sorry.
not your children, madam. I
Then
understood.
address.
Okay. The environment has changed. The schools have changed. The colleges have changed. Okay, previously there used to be people, what's the students getting scolded and beaten by teachers. Now all that environment has changed. They are focusing on their what's say kids making money for them and their status. Okay, the environment has changed. Okay, you have to directly or indirectly pass the message. You only can try, and if you are trying to emotionally get attached to those
No, no,
kids,
no. My question is tomorrow I'll be out as a counselor. So now I am a student. So tomorrow as a counselor, I am
you put,
asking my professor how to deal with this kind of situation.
madam, it's only, see, you have to put forward your points. If they don't listen, give them indirect, not if not direct, indirect indications on how that works.
That's
Okay,
what
you
sir is
tell that you
giving the
make,
proper counseling how to
you
give.
have to have, if they are not listening to the direct references to their kids, then you tell that generic statements towards the people of this age or kids of this age. And one more thing, don't think otherwise, madam. We cannot get empathetically associated with people who are not listening to us. Okay, we only can try to resolve the issue. If we try to empathetic, because I see that emotion in your discussion. If we try to empathetically or emotionally attached with no detachment, okay, we may be sincere. We have to be sincere to our work, not emotional or any kind of attachment to the subject or the person whom we are dealing with it. Whether you are
What are the
manufacturing, whether you are a
characteristics
counselor.
features of a counselor, sir? I'm sorry to interrupt you. What are the
Madam,
characteristics features of a
madam,
counselor? We will
you
have
are
a
trying
debate
to
session later.
Please let the sir
Let us
speak,
let
madam.
us sir
Please
speak.
let our professor
let the
speak.
class
Acha.
complete, madam. You are trying to
We are
take this
dealing with the
emotionally.
subject only. No, no, no. I am only dealing with the subject only. If you see, if you turn over the pages, you will find the questions what
Okay,
I'm
okay,
asking.
madam. Let us
The
complete the
frustration
class,
has
madam.
come. I have
Let us
brought up
come,
the topic. Okay, what is relevant and what is there in our book. I am only
madam.
asking that. If you prepare before the class, then you will correlate the questions what I am asking, sir. Thank you.
Madam, point is not trying to. Okay,
See, my advice is that my this response is that so don't give the any counseling these things based on your own experience and based on our own experiences. So better to take the help of the psychological theories subject. Then only we will be in a position to give proper counseling to any sort of cases. Okay, don't depend upon our own. So that is just like a layman counseling. Our psychological counseling is based on the psychological principles, theories, and psychological experiments. Okay, please try to understand the psychological subject. In that psychological subject only will get solutions of any sort of counseling.
Sir, due to this substance intake, do children fall into diabetic, or is it is only these kind of diseases will be inherit, means like genetic? Hello, sir, am I audible?
Yeah, you're audible, but